Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Metastatic breast cancer, that is new drugs which is involved in the chemotherapy. Now the treatment for the metastatic breast cancer is by targeting the P13K, 8KT as well as the mTOR pathways. And this has led to a newer chemoprophylactic drugs. So this has led to the newer chemoprophylactic drugs, and they are as follows, such as it includes a cyclidine, and then there is also, so first one we saw is the chemoprophylactic drugs such as the cyclidine dependent kinase. Kinase 4/6 inhibitors. So what does the cyclin dependent kinase 4/6 inhibitor include? So this includes the palbociclib. So palbociclib is nothing but an approved for the use of the aromatase inhibitors. So palbociclib is for the approved use for the aromatase inhibitors. It is aromatase inhibitor, that is, it includes the letrozole or the SERD, that is a fulvestrant. So next, under the cyclin dependent kinase, it is 4 and 6 inhibitors. So first we saw is a palbociclib, then is a ribociclib. There is ribociclib. So in ribociclib, what is approved? So it is approved for the use with the aromatase inhibitors. So it is approved for the use with aromatase inhibitor, that is the letrozole. Then comes the abimaciclib. So abimaciclib, it is approved for the use of the SERD. So it approved with the use of the SERD, that is a fulvestrant. Now let's look at the mTOR pathways. So mTOR pathway inhibitors. So under the mTOR pathway inhibitors, there is the everolimus. So the everolimus is nothing but it is approved, and this is for the treatment of advanced plus the metastatic hormone receptors. It is for the advanced or the metastatic hormone receptor. So it is positive. Then the HRE2 is negative breast cancer. So it is positive, and HRE2 negative breast cancer. It is advanced for the advanced and metastatic hormone receptors, positive. So then there is the other heading, phosphatidyl ioinositol 3 kinase inhibitors. So it is nothing but the P13K inhibitors, and here there is the buparlisib. So buparlisib. So it is not approved, but trials are underway the treatment of the metastatic breast cancer. So metastatic breast cancer trials are underway. Then we move on to lastly the AKT. So there is AKT. So there is AKT, that is nothing but the protein. AKT is nothing but the protein kinase B. So protein kinase B inhibitors. So under this there is the ipata. So ipatasertib. So ipatasertib. So ipatasertib, it is not approved, but it is found beneficial for the. So it is very beneficial for the metastatic. So it is beneficial for the metastatic triple negative. So metastatic triple negative breast cancer. To learn and grow daily like this, please do subscribe.